Hi, I'm Dr. David Smotrich. I'm the founder and medical director of La Jolla IVF. In vitro fertilization, we use medications to encourage a woman's ovaries to grow and develop. We use vaginal probe ultrasound as well as blood hormonal levels to make sure that her body is responding appropriately. When the lead follicles reach about 18 to 20 millimeters in diameter, under ultrasound guidance, under anesthesia, I stick a needle through the vagina into the ovary and in a simple 15-minute procedure, surgically remove eggs. Those eggs are placed in a petri dish, and then the gentleman's sperm is evaluated, and there are two approaches. One can take a conventional IVF approach, where 50,000 sperm are placed on top of each egg, and then we rely on the sperm's ability to penetrate the egg, and the next day we know if you have embryos. Or, more commonly, we use a procedure called ICSI, or Intracytoplasmic sperm injection, where under the microscope we hold a single egg and we insert a single sperm into each egg under the microscope, and the insertion of the sperm occurs into the cytoplasm of the egg, and this is called ICSI, or Intracytoplasmic sperm injection. For our example, let's say that the egg retrieval occurs on a Monday, and we know that the woman had about 15 follicles, and from her 15 follicles, we were able to get 15 eggs. Not every egg we get will be healthy enough to fertilize, and unfortunately, not every fertilized embryo will be able to continue to grow and become a healthy child. Monday, we know number of eggs, and that day we place the sperm and the egg together. Tuesday, we know how many fertilized eggs or early embryos we have. We watch in the laboratory under the microscope. The embryos continue to grow and develop to the 5th day, which is called blastocyst. Frequently do a procedure called pre-implantation screening of the embryo on the 5th day, with results 24 hours later on the 6th day, and allows us to sub-select the best embryos to place. Some patients choose not to do genetic screening of embryos, and then we use microscopic evaluation to select best quality embryos to place. Embryos are transferred into the uterus using a very small catheter and done under ultrasound guidance. We place the woman on bed rest for 3 days, and then 2 weeks after we know by blood test if she's pregnant or not. Every embryo that is growing and developing and doing well in a healthy environment that is not placed has the ability to be frozen in the laboratory. Embryos that unfortunately stop growing in the lab are no longer viable and therefore are not placed as well as not frozen.